Good day, everybody. Great to see so many joining us here today in this webinar on pandemic preparedness and response. I must say I look very much forward to the discussion here today. The report that we're going to take out, which is the outset, the basis for this discussion, has been prepared by the Raoul Wallenberg Institute of Human Rights and Humanitarian Law, together with the Office of the High Commissioner for Human Rights. And the study is done in 15 countries. And the work has been kindly supported by the Danish Foreign Ministry and ANIDA. In this work, we have used two unique tools. One tool for analyzing laws and policies, and the other one, crowdsourcing, for actually assessing the impact on the ground. I mean, one thing is that you make laws, another thing is how does it work? So we're anxious to hear much more about these tools from our panelists. And why coming up with new tools? Because in a situation like the one we have been in with now the past 12 months or more, we definitely, with limitations in traveling and traditional monitoring, we had to come up with something new in order to see what is it that we should look into when building forward better, sort of when we're on the other side of the pandemic. So to discuss this, we have an extremely competent panel here today. If you want to know more about each of the panelists, instead of I do long introductions of each of the panelists, you can find their bios in the chat as well as in the invitation to the seminar. I'm also very pleased to co-host and co-chair this session with Todd Howland from the Office of the High Commissioner, where we have had an extremely good collaboration between the two organizations. And finally, questions and comments you put in the Q&A, and that will be administered by Elina Hammerström, who is also sort of the engine behind the report. So with that, and without further ado, I want to pass the floor to Matthew Scott, Senior Researcher at the Raoul Wallenberg Institute. So over to you, Matt.
Thanks, Morten. I will share my screen and get started. So, to limit the webinar fatigue, we'll have our presentations limited to about 8 minutes. So forgive me for going relatively quickly through some of this. As Morten said, if you're particularly interested in the topic and what we've got to say about it, you can have a look at the report that we've produced, which is on the website, and there's a link in the chat for that. What I'll do in my introduction is talk a little bit about the why we adopted a human rights-based approach to pandemic preparedness and response generally, and to this pilot study in particular. Then I'll talk about how we did what we did, introducing briefly the tool that we use to systematically analyze national legal and policy responses from a human rights perspective. And then I'll talk a little bit about ways forward, what we think are important avenues to continue to pursue in this area of human rights and pandemic preparedness and response. So why do we take the human rights-based approach? There are what you might say are internal as well as external reasons, although that framing could be revisited. But when I talk about internal, I mean there's a clear and inherent human rights legal perspective that can be brought to bear on this idea of pandemic preparedness and response, based in the fundamental idea that the state has a duty to respect, protect, and fulfill the rights of people within their jurisdiction. And when we think about both failures of preparedness and implications of responses, we know that there can be adverse impacts on the enjoyment of human rights. So that line of thinking leads us very clearly to the conclusion that we need to adopt a human rights-based approach to the issue of pandemic preparedness and response. This is something that needs to be led by states, but as we say in the report, entails very much a multi-level and multi-stakeholder kind of engagement. But the lens that we bring to bear on the country reports is from the perspective of what states are doing and where there are avenues for further kind of improvement. But there's also, and this is why I might not call it exactly external reasons, but integrated aspects of the international, what you might call the post-2015 international frameworks. All of these, which you can see in the right-hand side of the screen, expressly endorse a human rights-based approach. So we have Agenda 2030, which includes the Sustainable Development Goals, calling for a human rights-based approach, same as the New Urban Agenda, the Agenda for Humanity, the Global Compacts on Migration and Refugees, and the Sendai Framework for Disaster Risk Reduction. So all of these are saying we need to take a human rights-based approach, but sometimes we need a little bit more material to articulate what that approach means in different contexts that we're dealing with. And that's what we've tried to do in the report, articulate this human rights-based approach. So how did we do that? Similar to earlier work that we did, looking at displacement in the context of disasters and climate change, we took a multi-level approach. So adopting a human rights-based approach meant starting with international standards. Now, as this was a pilot, we haven't taken the step of actually consolidating and compiling key international standards and guidelines that are specific to different areas of life that are affected by the pandemic and its response. But we've started with basic principles of international human rights law, ideas of proportionality and necessity, ideas of non-discrimination and equality, principles that are integral to the enjoyment of substantive rights like the right to health, the right to life, the right to shelter, and so forth. And these are effectively consolidated in this UN framework for the immediate socioeconomic response to COVID-19. And it's from that document, which kind of articulates a vision for how the UN system is responding to the pandemic. It identifies in its annex 10 human rights indicators that we need to be thinking about. We've got 9 here because we've integrated vulnerability and discrimination indicators into one. For sake of simplicity in the report. But when we look at national legal and policy responses engaging these areas, we tried to do it systematically using a tool that we've developed and that we rolled out with collaborators in the different countries where we were looking. And that yielded the report which we're talking about today. Now, the report itself, we definitely don't have time to go into the detail of, but some of the key findings you can see on the screen relate both to areas of concern as well as promising practices. And although there are multiple areas of concern, such as you can see on the screen, relating to the lack of this integration of measures that have requirements of proportionality and necessity, for instance, when it comes to interfering with fundamental rights, when it comes to the wide range of discretionary powers afforded to officials relating to different aspects of pandemic response. Even though we see those areas of concern, we also see a lot of promising practices. And this is what we emphasize in the report and provide multiple examples of from the countries that we looked at. We really see the seeds for future development in pretty much all of the countries that we looked at. And so if you have a look at the report, you'll see a lot of attention is paid to the rights of people in situations of potential vulnerability, there's focus on substantive rights, there's focus on access to information, and a lot of the other considerations that are included in that framework that guided our research. But what we didn't see was a systematic, coherent, human rights-based approach. And we flesh out a little bit what the implications of not adopting this systematic approach are in the report. Now, having finished this pilot phase, we're now at the point where we're starting to think what to do next. And so far, we can see at least 3 aspects of a human rights-based approach to pandemic preparedness and response, including further work on integrating human rights into law, policy, and procedure. So looking specifically at the measures that states are taking and working with them to better integrate the human rights principles. Also, when it comes to promoting the implementation of the human rights-based approach, that requires work relating to budgets, it requires work relating to data and training, integrating human rights into university curricula, and so on. And as I said at the beginning, and this is the final point, we need multi-stakeholder, multi-level engagement. And that's what we call for in the report. And that includes, and this is how I hand over to Lynn, further work within the UN system, as well as at the more local levels and national levels. But Lynn, who I'll hand over to now, will talk more about the UN system and what it's doing to further this human rights-based approach to pandemic preparedness and response. Thanks so much for being here.
Thank you very much, Matthew, and for the introduction to the report and the methodology. And I would in particular also highlight what you did on the promising practices in the report, which I think really illustrates well, I mean, that these things can be addressed, and there are countries actually doing it. I think it can definitely serve as a stimulating incentive to other countries in the future. So Lynn Gentile, who is focal point Right to Health at the Office of the High Commissioner, will now continue. Lynn, please.
Good morning, colleagues. Good morning, everyone. And thank you, Matthew, for opening up the discussion. As Matthew was saying earlier, my role really is to talk a little bit about what OHCHR especially has been doing. I'll mention something of what the special procedures and treaty monitoring bodies have been doing. But it's really just to give you a bit of a picture, the broad strokes of what we've been doing to respond. So now I think we're all agreed that COVID really presented an extraordinary challenge for human rights. And I feel that for once, when we say often that COVID is an unprecedented situation. And for once, this was really, it really meant that it had no precedent. This was a situation without precedent. We were taken by surprise. And I think we remain in the throes of a protracted crisis with many, many faces. So I'm just going to look at how OHCHR has positioned itself to address this crisis. And the premise, I think essentially, as Matthew was saying, was that really we were after as being critical to the response. The UN has come up with a conceptualization, or perhaps
Lynn, I'm sorry, your PowerPoint isn't showing. If you're showing slides, it's only showing your thing where you open it.
Is that better? No? You've not seen any slides?
Maybe restart the sharing.
Okay, let me stop and start. Pause. Is that better?
No.
Okay. It says I'm screen sharing. Let me try again.
There we are.
Okay.
So if you just open the presentation to.
Okay, so essentially where I was that the UN system has developed a strategy which we've termed Building Back Better. That's mainstream throughout the UN system. And what I'll try to talk a little bit about is what has Building Back Better actually meant for OHCHR. Now, the short answer to that is that it's essentially a human rights-based approach to addressing COVID, all of its impact, plus all the impact of the response measures which states have taken. In more detail, if we take a look at our usual functions, so the guidance and the technical support, the leadership on issues involving human rights, supporting member states, the UN system, and other stakeholders in upholding human rights and in integrating human rights into the response. And then, of course, advocacy is a key element of that. But in terms of substantive work on this, we've worked on many fronts. We've come at this from a number of fronts. And I'll just mention some with the bias, of course, on economic, social, and cultural rights, because that's what I'm mostly involved in. But there was one key area which had to do with enjoying health and living in dignity. So in that line, we looked at economic, social, and cultural rights, so health, social protection, education, and work. And in this, I think we can say that an emerging sort of axis of interventions has to do with universal health coverage and universal social protection. And depending on the context and what's relevant nationally, we'll find that an emphasis on education, on work, on the right to food could also be necessary and useful. And then, of course, the leaving no one behind has really informed how we've worked. So OHCHR has put out a lot of guidance, say on persons with disabilities, on how women are impacted, especially because women also form a huge part of the health workforce. We've looked at migrants as well, the rights of migrants. Lately, we're looking at that in the context of vaccines, especially, which is a big issue. So really, a lot of our work has focused on how do we ensure that people who are normally left behind don't get left behind as the COVID crisis progresses. And the other axis of our sort of intervention now, which is developing even more momentum, is preparing for crises. So the UN system is really looking at building back better from two perspectives, addressing the immediate crisis and also what needs to be done in the future to make sure that we're ready when something like this happens again. Perhaps a key example, which Matthew alluded to earlier, had to do with the UN Socioeconomic Response Framework, where UNHCR contributed a lot of the human rights sort of conceptualization, the human rights standards into that. From the treaty bodies and special procedures, I would say that we've seen an emphatic response from them. There's been a lot of guidance, a lot of statements, and a lot of even press releases which the special procedures and the treaty bodies have issued. So basically what we're looking at is they've looked at emerging issues, things like what we refer to as immunity passports, still very much up in the air, and also looking at where has there been a new urgency to known issues. So for instance, vaccines would come under that. But essentially where I'd say these human rights mechanisms have been mostly active is with their reaffirmation of the norms that we have, and also a strong focus again on marginalized groups. So just to give you an example, we've had the treaty bodies have spoken about access to vaccines. They've advocated for universal and fair access to vaccines. We've had a lot of statements and guidance come out on economic, social, and cultural rights, even on international solidarity, because as you know, when we think of the right to development and the benefits of development being fairly shared, that's a big issue. And then also on the special procedures side, we've heard from them on the protection of the right to privacy, which is also big when we think about surveillance and tracking systems. That's an important issue. And also things like I won't say mission creep, but when derogation creep may be an interesting term. When we see derogations there, we're not quite sure how long they're going to last and what are the repercussions of maintaining a derogation from rights. And then we've also had the UN system coming out a lot in terms of persons with disabilities and violence against women. So there's two building blocks of the UN human rights system really putting their weight behind a human rights-based approach, but across the board. And then just to end here, if we want to look ahead at what OHCHR and certainly the UN system as a whole is likely to be looking at, I think what we're going to think about is what can be done to better prepare for pandemics and other health crises. And when we look at the work that has come out with the report and also the analysis of the specific countries, we can see that there's a clear utility to having this this analysis going on. The tool itself is going to be very helpful, and really, even if we look at how the special procedures have addressed this, they have urged that states take certain measures, especially legislative measures, to address the issues arising from the COVID crisis. So we can see that there's really a possibility to make really good use of this tool. And of course, OHCHR will also look at promoting economic, social, and cultural rights. And especially our advocacy will focus quite strongly on universal health coverage and universal social protection. We've also put out fairly recently, a statement on vaccines and just emphasizing key norms around vaccine availability. And this is going to be a big issue as we look also at things like mandatory vaccination and whether this is in fact legally tenable position, even looking at the practice that we have in other, when looking at other vaccines. And finally, I would mention strengthening multilateralism, the multilateral system, where we've seen that weakening somewhat is with the acquisition of vaccines and everybody wondering, what will be the status with the poor countries. We've started to see some trends around that, which are quite worrying. And so that'll be one area where there'll be a big focus. So I think I'll stop here with apologies for the technical glitches, and then I'll hand back to Morten. Thank you.
Thank you very much, Lynn, for this excellent presentation of sort of the impact of the human rights mechanisms on the work in relation to the pandemic, which I definitely think is seen and picked up extremely well in very many places. So thanks a lot for that. And that brings me on to the last speaker of our first panel here, Ambali Dithian from the Arnisak Foundation in Mumbai. So really from the global now to the local. So welcome to you, Ambali.
Thank you. I hope my presentation is visible.
Very good.
Good day, everyone. I'm Ambali Adityan. I'm Raoul Wallenberg Institute and OHCHR Fellow, and today I'm here to share my work on practices and policy response to COVID-19 pandemic from a human rights perspective in the state of Kerala, India. So before we move to the legal and practice analysis, let me give you a quick glimpse of the state Kerala. Kerala, branded globally as God's own country, is the 13th most populous state with a population equivalent to, or rather double of Netherlands. Kerala's model of development is widely popular with the highest literacy rate, a positive sex ratio, and only 7% of the population below poverty line. Kerala has made substantial strides in human development, which is comparable to many developed nations. Migration is a dynamic factor in state's development, and today the state stands 10th largest economy in the country, with remittance from immigrants contributing to 1/3 of state's GDP. The state provides highest amount of wages in unorganized sector, and that's why it's home to 3.5 million interstate migrant workers, which is 10% of the state's population. Before we move ahead, I would just like to highlight that Kerala faced Nipah virus outbreak in 2018 and massive statewide floods in 2018 and 19 respectively. This shows that state has experience in emergency preparedness and outbreak response, and the learnings from the disaster came in handy for the state to manage COVID-19 pandemic. So I'll first begin with the process of crowdsourcing. So with a mandate to help world readers better, OSCH initiated a pilot crowdsourcing project with the aim to collect the accounts and perspectives of beneficiaries from the ground initiatives undertaken during the pandemic, with the whole intention to gauge whether it would work or it would reflect as a promising practice or not. So a simple questionnaire was developed and was uploaded on a cloud-based tool for collection of this information. So in Kerala, the strategy was a state-level webinar was organized, wherein the state representatives were called in basically to ensure their buy-in for the project and seek their support for identification of best practices. However, the main challenge incurred in communication and coordination with the civil society and local government because of language barrier. And that's when a need was felt to have a dedicated person from Kerala to steer the project. So in the revised strategy, me and a group of volunteers representing 14 districts of Kerala were involved in identification and population of database developed by OSCHR. So over the course of 3 months, we received more than 100 responses. And it was then on to us to analyze this based on various parameters. So on the first, what we did was we analyzed them based on the type of beneficiary. So a state which boasts of a large number of migrant workers, both interstate and returning migrant workers, it came as a no surprise that migrant workers were the beneficiaries for most of the responses. This was followed by economically marginalized, children, healthcare workers, and so on. When we analyzed them based on the type of human rights, we saw that the right to health was the most common, followed by access to information, right to food, right to work, and so on. So again, I see that this is in line with the UN framework for immediate COVID-19 response, which emphasized on protecting health by ensuring supplies and services during the pandemic. So as I said, there were more than 100 responses, rather close to 150 responses. So I do not have time to emphasize on all that now, but I'll just highlight 2 major responses undertaken for the interstate migrant workers. The first is Bandhu Clinic, which was a collaboration of state government and civil society, which is a mobile unit providing doorstep medical services to the migrant workers. And this service not just provided essential healthcare service, but also undertook COVID-19 screening for these workers, considering the kind of living conditions they were in. And over the period of 6 months, almost 60,000 migrant workers were touched through this service. On the right-hand side of the screen that you see is Bandhu Helpline, which was a 24/7 helpline service for migrant workers, available in 4 languages commonly spoken by these workers. The intent of the helpline was not just to provide access to information regarding COVID-19, but also connect them to the nearest relief center, allay their fears, flag their concerns to the local government authorities, and so on. So this was the bottom-up crowdsourcing analysis as part of OSCHR. I also undertook a top-down legal policy analysis based on a tool developed by RWI. And once I had both set of responses, it consolidated, and then trends and any synergies and gaps were analyzed. In order to understand the gaps, I developed something called as an evaluation framework, which helped me not just to look for gaps and synergies, but also provide something called as an evidence-based informed recommendation to the state for future preparedness. So the responses that I received, I categorized them into relief measure, which is a short-term to medium-term impact, a relief measure with a long-term impact, and a recovery or an existing measure with a long-term impact. So in case of an interstate migrant workers, the state was proactive in providing food as well as shelter. However, there was no mention on the health needs of these workers. That's when a collaboration between civil society and government came together and provided doorstep medical service to these workers. And as discussed earlier, migrant-sensitive communication strategies were also developed. Now, apart from all these ad hoc welfare measures, a state with a growing population of interstate migrant workers, there is absolutely no institutional mechanism in the state as of now to provide access to services like compensation, benefits, insurance, and other such services to the workers and their families. This is extremely crucial in times of pandemic. Now, the next I identified was LGBTQ community. Again, the state provisioned dry ration kits to these people. A pre-existing community-based organization ensured that there was a 24/7 helpline for mental health counseling of these people. However, the state lacked adequate shelter to provide immediate relief during the lockdown. Considering that these people faced domestic violence, stigmatization, this was absolutely necessary. Similarly, the COVID-19 healthcare infrastructure that was developed in the state was inadequate to their needs. That means there were no unisex toilets, beds, and other facilities in such kind of an establishment. So similar to these two, I did for more, but right now I do not have time to delve into all this. Now, apart from all this said, documenting the best practices and analyzing them, this project also gave me a scope for potential collaboration and adoption of ideas and replication. So National Health Mission Ernakulam is now considering something called as adoption of a best practices that was documented by OSCHR in their own respective districts. So something that was happening in some other district, because of this project, it gave them an opportunity to collaborate and adopt practice in their respective districts. Similarly, a project for safe menstruation, which happened outside Kerala, is now being adopted in the state by Ernakulam district. I will not delve more into this because our next panelist, Dr. Matthews, will be speaking more about it. So,
one minute.
As a climate change professional working in the space of climate change, adaptation, and resilience, I feel that climate crisis is similar to a pandemic, but with a severe impact on a longer time scale. And it's time that we look to mitigate these efforts so as to reduce the loss of life and livelihood. And with this, me and the group of volunteers would like to thank each and every one of you. Thank you so much.
Thank you very much, Ambali. This fascinating presentation, and also showing the strengths and the added value of the crowdsourcing, and how you then can use it for analyzing what are the concerns, and how it also match very well with the other tool, and the two goes very well in hand in hand. So with that, just one comment from the last comment from my side now is that I've noticed a few of you raise your hands, and that's very nice, but please ask your questions in the Q&A, and then Elena will look at it. We cannot administer the raised hands. So over to you, Todd.
Thank you, Martin, and hello, everyone. I just wanted to remind people a little bit about the structure of this collaborative effort with the Raoul Wallenberg Institute. Part of it was that we both organizations understood the significant challenge that we'd be facing. So that we thought, well, how do we actually begin to look at both policy and realities? And through that, we actually came together and hired 14 local researchers or fellows to work in 14 countries plus one, the state of Kerala. And it's they working through, often with the local Raoul Wallenberg Institute and with our own office, that we're able to really look at what was happening in terms of the developments in law and policy, as well as helping us understand the realities. Today, in the second part of the panel, before we move to the Q&A, I have two guests, Dr. Matthews, who is the district manager of the National Health Mission in the Kerala state, and Li Feng, who is the human rights advisor to the UN country team in Kenya. I'm going to ask both of them two questions, and so they have 4 minutes for each question. So it's quite a limited amount of time. But I did want to thank both of them for taking the time to be with us, to also give us the perspective of the importance of human rights relative to the work that they're trying to do at this particular difficult moment. So Dr. Matthews, thank you for being with us. I have the first question for you is how Kerala State is addressing the COVID-19 crisis. And I could give you the second one, or I'll wait to finish the first one. Thank you. Over to Dr. Matthews.
Thank you. Good afternoon, everyone. So the first case of COVID-19 in India was in Kerala. That was in last week of January. Then a few more cases came, and our country went for a lockdown in March, around March 25th. During the lockdown, it was a difficult situation for the people, and it was rather suddenly declared. So there was no enough time for preparation for the people. So our main aim was to ensure food for everyone. No one is left behind like that. We should be able to ensure food for everyone. That was our first aim. So we started community kitchen in Ernakulam district with a population of 32 lakhs. There were more than 500 community kitchen where people could come and take cooked food from this kitchen. So in that way, we could ensure that everyone is having food. So this kitchen has been running with the support of the community, the NGOs, the local panchayats, and the people were all participating in this process. And by that community involvement, we could ensure that food was available for everyone during the lockdown period. And even after lockdown, the lockdown has been released slowly after that, but the food kit is being continued. Now cooked food is not being given, but food kit is being given to the needy people by the government. So that is now continued now also for the people. Second one was to ensure the medicines and doctor's consultation for the patient. That was the second challenge. We have a good system of this public health system is there, primary health centers, community health centers, and also along with this, the private doctors and private hospitals also collaborated. And in every panchayat, we had a team of doctors and nurses who could give free phone consultation to the patients, and also we could give medicines to the doorsteps as per the need of the patients. And that is also being continued as a telemedicine system now in the PSCs and also in the district. Now also the same system that even though all the hospitals are open now, we could continue that telemedicine system for those who require teleconsultation and medicines now also. In that way, we could ensure health during the lockdown period of all the persons, including the marginalized and the guest workers, migrant guest workers also. The third issue was the stranded people. There were people stranded outside, the Malayalis were stranded outside Kerala in other countries and also in other states. And also many foreigners and migrant guest workers were stranded in Kerala. So first we received all the people who were stranded outside with enough quarantine places and a support system. And we could also send back the stranded people in Kerala in a respectful manner to their own home places using the special trains, special vehicles and airway system like that. So that in that way, stranded people was also this stranded problem was also ensured. So.
Dr. Matthews, thank you. Thank you very much for those concrete examples. Now what I'd like to ask you is about the utility of a human rights-based approach and this project for the Kerala state in terms of looking at existing law and practices. How has this been helpful, and how could such a project be helpful if we were to expand it?
Yes, in during this process of this lockdown and after that, we could interact with a lot of organizations and lot of other NGOs like that, doing projects for the people, like Mrs. Ambili, then Tata Institute of Social Sciences, and many innovative projects were there. So that was the main outcome of this intersectoral work and collaboration with the NGOs and other people. So there were many like projects were running in Kerala, mainly for the guest workers, analyzing the issue. The project could analyze the issues of the guest workers in a scientific manner. That helped us in planning the strategies for the guest workers during the lockdown and also after the lockdown, and that is also being continued now also in that manner. And also, like Ambili pointed out, this menstrual cup project and also safe dental practices, which they have done it in other districts, and we are also planning to adopt that system here. So this COVID gave us an opportunity to know about the works done by the different NGOs and other people in other states and other countries, and we could adopt the best practices in other states, so that this will help in planning us in the future, and also improving the services offered by our National Health Mission, or also by the district administration to the people.
Dr. Matthews, I think just to give you a couple more minutes, if you had a couple of practices that you would like to share globally in terms of what you feel have been essentially so important. I know you mentioned a couple at the beginning. You're speaking to a global audience, so I'll give you just an opportunity to share what you really would like to share with others in terms of saying that they want to try the same.
In COVID, as far as COVID is concerned, the testing and the treatment were given all free to all the people in Kerala, and there were enough testing centers, and also we were keen about this load balancing of patients. We were afraid that the health system may break down, because Kerala is having a large population of elderly and also chronic diseases there in Kerala, like any other developed states. So we were afraid that the health system may break down, but we could plan adequately with CFLTs, first line treatment centers, second line treatment centers. They were built outside the hospital system, taking halls and converting them into hospital. We could make enough first line and second line treatment centers, supplemented by the system of hospitals already existing. In that way, we could clearly prevent the health system from breaking down, and also we could ensure this PPE kit and other support system for all the health staff. So we could face this pandemic without much issue, both to the health system and also to the public, because of the planning we have done. Especially we had earlier this incidence of flood and Nipah. That the experience of that helped us a lot, and we are now confident that the health system and people could manage any crisis if we work through that like that.
Well, thank you very much, Dr. Matthews, for being with us, and hopefully you'll stay around for the question and answer period. I'm going to move on to our next guest, is Li Feng, the Senior Human Rights Advisor to the Resident Coordinator UN Country Team in Kenya. Lee, are you with us?
I am.
Very good. I'll just start with the first question. Again, you have 4 minutes for each question. How is the UN working with authorities to address the COVID-19 crisis in Kenya? And how have you, as the Senior Human Rights Advisor, contributed or brought in a human rights perspective into these efforts?
Thanks, Maybe just quickly for a bit of background, the first case of COVID was detected in Kenya in mid-March 2020, and very quickly the government put in place a raft of prevention and response measures, which included immediate closure of schools, stay-at-home orders, and then quite quickly a nightly curfew, and then mandatory wearing of face masks. So that's just to give a little bit of the setting. And since mid-March, the UN country team in Kenya has worked very closely with the government of Kenya to support the COVID-19 response, both to address the immediate public health crisis, but also the secondary impacts of the pandemic. An emergency appeal was launched by the UN in April 2020, which covered the public health response, the provision of essential services and social protection, and fostering an enabling environment through a human rights-based approach and a gender-sensitive approach. And it very much drew already on what was the existing engagement of the UN family in Kenya. As the country team, we also developed a socio-economic response plan, which explored the multidimensional nature of the crisis and was aligned to support the government's socio-economic recovery strategy for COVID, and then also more broadly with the Sustainable Development Goals. So in all of this, a human rights-based analysis of the COVID-19 crisis and its impacts is required to inform the efforts. And in particular, it's important to look at inequalities and groups left behind to ensure their inclusion in response and recovery efforts. And this is where my role as the human rights advisor to the UN resident coordinator came in. To work with my team here to monitor and analyse the human rights impacts, particularly for vulnerable and marginalised communities. My team and I had already pre-existing partnerships with networks of grassroots human rights defenders, and we had worked together on a human rights-based assessment of the right to water in informal settlements just prior to the COVID-19 crisis. So it gave us a good launching point to very quickly, after the first case of COVID was detected, to launch remote monitoring of the human rights impacts of the emerging crisis in informal settlements. And this is noting that in informal urban settlements in Kenya, there are long-standing inequalities in access to services, particularly water and housing, in addition to persistent police brutality. So what we did was that we developed a questionnaire, and grassroots human rights defenders in informal settlements and marginalised communities undertook household surveys in their communities across 9 counties to probe the impacts on civil, political, economic and social rights. And these were then uploaded via a secure smartphone app for analysis by my team and I. So it's similar to the crowdsourcing initiative that Ambili was speaking to. And what the findings indicated was that the crisis, including the enforcement of the government emergency measures through a nightly curfew, which was enforced very, very brutally by police, and also the mandatory wearing of face masks, which also used excessive use of force. These really exacerbated the underlying issues, particularly in terms of access to water, affordability of water, and had a significant impact on the human rights situation, particularly also for sexual and gender-based violence, livelihoods and economic and social rights, and then police violence. So these findings informed the development of the UN emergency appeal, and then subsequently the socio-economic response plan, to be able to indicate the priority areas, the gaps for vulnerable marginalised communities, and the specific human rights concerns to be addressed. And maybe just quickly, I'll just also speak to some of the responses to identified human rights concerns that my team and I then mobilised on. We then drew upon existing initiatives that we had with government counterparts and with civil society. One was a task force with government, working with the Director of Public Prosecutions, the Independent Policing Oversight Authority and National Police Service to strengthen investigation and prosecution of human rights violations. And we used this mechanism to obtain data on police excesses during the enforcement of the curfew, to follow up on investigations and disciplinary action, and then to urge accountability. We had also been engaged with networks of survivors of sexual violence through a different initiative project that we're working on with UN Women on electoral-related sexual violence, but we mobilized this network to provide support to survivors of SGBV during the COVID-19 period to be able to report cases and access services and responses. And one other thing, just briefly, is just to note that what also came out a little bit later after the response plan was already underway was that we had very little information on how the COVID-19 crisis was playing out in the Indigenous communities and how little information they were actually accessing on COVID-19 itself, prevention measures, and also the government's social protection and economic responses. So then we launched another remote monitoring initiative, working with 49 Indigenous human rights defenders in 7 counties. That's across 13 Indigenous groups, to undertake some of these household surveys and also focus group discussions in their own communities. And what we did find was it was very different to what was happening in informal settlements. Issues like access to water weren't such a big issue, but the livelihoods issue was really critical. The closure of schools was really critical, and it really had a huge impact on young girls in terms of increase in sexual and gender-based violence, but in practices like female genital mutilation, which then led to early marriages and teenage pregnancies, which will have a very lasting impact for these young girls moving forward. So thank you.
No, thanks, Lee, for sharing those very useful and interesting practices. We just have a couple minutes left, and what I'd like to do is look at the research done with the Raoul Wallenberg Institute. One of its main conclusions relates to the lack of a systematic approach in terms of the type of research done on a human rights-based analysis. We're finding that oftentimes there's different pieces that are done depending on the lobby, depending on what's happening. But how could such an effort that we're making in terms of the 14 countries be useful in terms of your work in Kenya, in terms of looking at law and policy in a more systematic way to see whether it has a human rights-based approach?
Yeah. Maybe just to say at the outset that in terms of legal and policy framework for human rights and a human rights-based approach, Kenya actually has a very strong existing framework through its 2010 constitution and the Bill of Rights, because it incorporates international human rights obligations into Kenyan law and very much underscores the principle and the requirement of public participation. Implementation is then another issue. So I think that this is where the analysis of the laws and policies in relation to specifically COVID-19 and how they fulfill constitutional guarantees is really important, because it identifies where there are gaps, where there are potential unintended consequences, and then it really sets the scene to be able to say, based on the existing legal and policy framework, how can we improve implementation, or how can we improve how these measures are put into place? So I think that it's very useful in that regard. In terms of how do we actually adopt a more systematic approach, going forward and building back better, I think that using the Sustainable Development Goals is really important. And because a human rights-based approach to the Sustainable Development Goals is critical. And what we've seen is that the inequalities that were there were exacerbated by the crisis. So I think it's in this decade of action towards 2030, if we can really highlight addressing the inequalities, leaving no one behind, and then inclusion and participation, this is a more, I guess, a concrete and sustainable way and consistent way of moving forward. But definitely seeing where the gaps are in laws and policies gives us very specific entry points to be able to mobilize and advocate for change in those policies, but also in practice.
Well, thank you very much, Lee, and hopefully you'll stay around for the question and answer. And thank you very much for the work that you're doing and the contribution you're making. Over to you, Morten.
Thank you very much also from me to Dr. Matthew and Lee. And I think what we just heard now is illustrates so well how human rights can sort of be a very important tool in assessing who's left behind. using it as that analytical tool is just so powerful and very well illustrated by the presentations. Before we open up for the questions from all our participants, I just wanted to offer the possibility for the panelists, all the panelists, if you have any comments or questions, brief to the different interventions and presentations. Anyone who has something they would like to add or ask one or the other? Otherwise, I know we have a number of good questions from the audience. Matthew?
Yeah, I did have one reflection on one of the points that Lee made, which concerns the fact that there's no one size fits all solution. She was talking about the right to water and informal urban settlements, and then how the situation was different amongst indigenous communities. And that sort of also goes towards answering some points I've seen in the discussion and the question and answer about what can human rights do in a way. And it doesn't offer a silver bullet, but it provides this framework for thinking about how to, in particular, address the situation of people in different contexts where they may be vulnerable, and they may not be vulnerable in other contexts, but the situation of persons with disabilities, the situation of women intersecting with race or class or caste or indigenous status or immigration status, as we've also seen. So what the human rights-based approach provides is not a solution to fix COVID-19 tomorrow, but it does provide this lens for thinking systematically about the kinds of measures that can cause harm and the kinds of measures that can be introduced, preferably in advance, so we're not reacting, but the measures that can be introduced that address these things, ensuring that no one's left behind, or at least doing what is possible to the maximum of available resources to ensure that no one is left behind, and also to think about the complexity of social organization in a systematic way that is reflecting what the international community has articulated over the past 75 years, but also, as you said, Lee, domestic constitutional frameworks. And this is a point that's often missed as well, that it's not just international UN organizations saying, make sure that human rights are respected, protected, and fulfilled. It's domestic legal orders all over the world that have this as part of their constitutional frameworks. So that's just a reflection, and thanks so much for the other contributions.
Thanks, Matthew. Any other comments or questions? If not, I don't see any, but you can, of course, you're free to come in later on. So, Elina, what have we got in the Q&A box or in the chat?
Yes, I'm trying to function all of my different things at the same time. Let me just
You're doing brilliantly.
Put all my questions in order. All right, let's start with a question for Matthew that came in the chat and in the email and in the question and answer box. So clearly someone very excited to hear the answer. And the question is that in some countries, effectively all migrants have been excluded from the relief that has been provided during the crisis. And the question is, what have other states been doing, and what have their responses to the pandemic been in regards to the protection of migrants specifically, including all the different categories of migrants?
Maybe you can say who asked the question.
Maybe we might not, because we're recording. It might be better not to have people's names unless they agree to it. Sorry, but I can answer it straight away. And I also had the benefit of seeing the question come up in the chat, so thanks for posing it. It does come from South Africa. What I managed to do in being notified of the question was have a quick look through the material that we've gathered, because it's difficult to remember. But what the tool enables us to do is just search very quickly and find what measures exist to address the situation of people in different forms of human mobility. And I found that India has the Ministry of Home Affairs order on the movement of migrant workers during lockdown. Ethiopia has standard operating procedures for returning migrants. Cambodia has measures to manage migrants who've returned from Thailand in 2020. Uruguay has a decree number 104020, which provides measures to ensure access to the right to seek asylum, even in a situation where they had otherwise closed the border. So I probably don't have time to go into what the report says about those different measures. But what I can reflect generally is that these measures are there, but probably there's scope for a more systematic engagement across society. So you have these kind of one-off documents. So the Ethiopian standard operating procedures goes into questions about the return of migrants, their experience in quarantine, and reflecting quite detailed considerations about protecting children, including unaccompanied children, and other measures, which are clearly positive. It even goes further into looking about reintegration and avoiding stigmatization of migrant workers. So there's a lot in different parts, but there could be scope for even more systematic thinking in relation to different kinds of people in situations of migration. I didn't see anything relating to people who were in an irregular migration situation without documentation. Also nothing on statelessness. And so again, that reflects the potential contribution of a human rights-based approach to that more systematic thinking about it. I'll pause there to give people a chance to respond to other questions. I've seen about 7 that I can answer, so constrain me.
Thank you so much, Matthew. Let's move on to Lynn. So we had a question specifically about the OHCHR and how it's working to ensure provision of economic, social, and cultural rights in situations where the conditions were already untenable prior to the pandemic. So there's some examples there as well, but maybe you want to answer that in general.
Okay, I think Lee may also have something interesting to add, but my initial observation is that first, what we want to sort of always remember is that the primary responsibility for making sure rights are enjoyed lies with member states, lies with government. OHCHR cannot of itself ensure the enjoyment of rights, but we have a role to play in making sure that we promote and we work towards the protection and promotion of these rights. So some of the key things that the key sort of ways that the office does this has to do with monitoring and reporting, looking at what is the human rights situation around various economic, social, and cultural rights, who's being left behind, why are they left behind, why are they being left behind, and what is the law and policy framework? Is there an enabling environment for these rights? And then advocating with the authorities to make sure that these things are put right. Also, I think we have a really important role especially when we've got a new situation like COVID, in simply clarifying how the norms we know apply in a situation we've not encountered before, or perhaps not on this scale. So I think it's something we may take for granted because the norms are there, we've had them for a while, but I think there's a very clear value in being able to articulate where we now say we're facing the issue of vaccines. What does human rights law have to say about things like this? And so we'll look at things like intellectual property rights. What is the interplay between the policy space that states have and then intellectual property rights and human rights. So a lot of the advocacy in that sense will also focus on things like an enabling law and policy environment. So you'll see that Matthew's work, for instance, your work rather, yours and Matthew's work will be it'll be a handy tool for things like that. So I would, yeah, I think those are the sort of points I would emphasize. I don't know if Lee wants to add anything.
Maybe just to add, I think that what you brought up about the guidance that was formulated by OHCHR on various issues in relation to the COVID crisis was really, I think it was very useful because, for example, there was guidance on on the right to housing. There was guidance on the rights of persons with disabilities, on the rights of Indigenous persons in the COVID context. And I think it provided some very concrete also entry points to be aware of, to heighten protection. And I think that those were very useful for UN country teams, but also for civil society in advocacy. In terms of what we're doing on economic, social and cultural rights, as Lynn said, it's the government which has got the primary responsibility to guarantee these rights. What we can do is, through the monitoring, the analysis, give that indication of what are some of the barriers to those rights being fulfilled for all. And that's what we've attempted to do on specific issues, for example, on the right to water, and using that within the UN country team, for example, with those who are working on water and sanitation directly in programming, for them to be able to use in their programming, in their discussions with government stakeholders. Also to work with civil society on this, because they will then have information and looking at how we can do coordinated advocacy, even if it's supporting in the background. For example, very soon after the COVID crisis kicked off in Kenya, there was a coordinated civil society advocacy on the right to water to really push for the provision of free water in informal settlements for 4 months, so that people at least could wash their hands and abide by all the prevention measures. And this did lead to a government directive directing water service providers to do that, and to a lot of emergency measures to be able to provide, truck in some water to informal settlements. So that's what it can lead to.
Thank you so much, Lynn, Lee, and Lynn, both of you. I have so many questions. I'm not going to get through all of them, I'm afraid, but let's move on. And I'll take one for Ambali this time. So in Kerala, the project considered the legal and policy analysis, as well as this crowdsourcing that you talked about in your presentation. Could you elaborate a bit on the merits of the combination of the two approaches, of this top-down and the bottom-up approach coming together?
So I found that it gave a more comprehensive view to what's actually happening in the state, because when you just look at the top down, you know that there are some policies, but is it actually being implemented on the ground? For that, we need a bottom up approach. And the bottom up approach just didn't seek for responses from stakeholders like government or civil society, but also from the beneficiaries, from the horse's mouth, where we realize that is it actually, like, if community kitchen has been initiated by the government, has it actually reached the beneficiary? Were they really charged or not? So amalgamation helps you give a comprehensive view of what works, what doesn't work, and where exactly is the gap. Because if you just follow one method, probably you might lose on the other. So it gives a totality of the view, and I think it's a fantastic approach, especially in times like this, when you really do not know, where is and what is lacking. So if it could have been either, probably we would not have understood a good, we would not have a good overview of what has happened than an amalgamation. So, and plus, as I said, it gave me this evaluation framework, definitely gave a scope to look for those gaps and also look for those best or rather promising practices. So I think it was a great approach and should be followed for future projects.
Great, thank you so much. We hope to be able to continue with this combination of approaches in the future as well. Then we have a question for Dr. Matthews about Kerala. And there you mentioned community kitchens in your presentation, and that was an important part of the response. And the question is, how do you handle the situation if people cannot or don't have the capability to make their way to the community kitchen? So is there a way to reach people if they're not able to make their way there themselves?
No, actually, it was during the lockdown period. So the packed food was taken to the doorstep of those who need food. The system was working like that. We have this ward concern for every 1,500 population, and there is an elected member, there is a health link worker. So the people who need food can call or inform these persons, and they will go to the community kitchen and take the food to the doorsteps. Like that it was working. Especially it was during the lockdown, so people could not queue up like that. So we were particular about that, and all the packed food kits were supplied to the homes of people.
Thank you for the clarification. I also have some general questions. I don't know, now that we've gone through everyone once, perhaps we can ask in general what the panelists' views are on the use of criminal sanctions in connection with COVID restrictions and rules, such as in place for social distances, staying at home, gatherings, etc., from a human rights perspective. So I don't know if someone wants to jump in and take that question. Lee, please.
I can speak to that because it's definitely something that we saw here. And when you're giving the police the authority to enforce emergency regulations when they are known to enforce them with excessive force, it's really quite it's quite counterproductive in terms of how you can how this is then impacting on the communities themselves, because it does put them in greater risk. If they're arrested and taken to the police station overnight for not wearing a face mask, it does put individuals at greater risk of even catching COVID from being in detention cells. So I think that this is where some of those the analysis of how this can play out and how this could be how the policy measures can be enforced in a negative way is really important. And in our case in Kenya, I think it got a lot of coverage because in the first month or two of the crisis, there were more people killed by police than by COVID. But that did lead to some very strong advocacy, and it has led to a change in behavior in terms of the numbers of killings and assaults dropping off after the first 3 months of the curfew. But I do think that those are some of the things to really bear in mind. And it wasn't just in Kenya; it was seen all over the world. And that's also where OHCHR had issued some guidance on emergency measures and rule of law in enforcing emergency measures. So it's an important point.
Did anyone else want to jump in on that one, or should we? Lynn?
Okay, I just wanted to add that, public health and criminal sanction have always had a very uneasy, uncomfortable relationship. If we think about the issues around HIV and the use of the criminal law to sort of to enforce certain laws and to enforce punitive views of certain minority communities, it's had a really difficult history. But as Lee was saying, it is counterproductive. I don't think it was just in Kenya, and maybe where the stronger point would be to actually think about using information. The right to health, for instance, mandates states are supposed to make health information easily and readily available, etc. So I think better results are likely to come from that when communities are involved in things like this, when they're given, when you place those tools in their hands, they can actually understand what the risks are. And I think perhaps it reflects a lack of trust in what communities are actually able to do. People do understand things like this if you take the trouble to make sure they have the information, walk them through whatever. So to me, that sort of signals a failure to appreciate perhaps the value of making good health information available, getting communities involved in the health response, because all of these things, in fact, will they'll not only backfire in the sense that Lee was explaining, but actually they in general, they affect the uptake of any health measures. And we'll probably see a lot of this around vaccines. We're already hearing a lot about that. Over.
Thank you. So a bit in Matt, did you want to jump in?
Yeah, I can jump in on that and possibly also segue into a different question that I saw, because both relate to this issue of preparedness that we talk about in the report. When we see these sort of punitive responses that have been described, the need to crack down to make sure people get into line, it does reflect lack of preparedness, at least in some contexts. And when we see the unfolding of an emergency situation like we've seen with COVID-19, it gives further pause to consider what we need to do building forward better in order to have not just a sort of state level preparedness in place, but that preparedness integrated through multi-level structures, so that when we get a notice that there is a hazard, whether it's of a biological kind, like the COVID virus, or if it's of a flood, or if it's of an earthquake where there's a little bit less time, a lot less time, when people get that message, and ensuring that people actually do get that message through early warning systems that reach people who may have difficulty accessing technology, may have literacy issues, may have language issues. If those preparedness mechanisms aren't in place, that's when you'll find more perceived need to respond in a heavy-handed way to make people get into line, because people might not understand the risks, might get different kinds of messages, might have fake news circulating. So I think a strong message that comes out of the report that we put together is having rights-based preparedness measures in place in this multi-level, multi-stakeholder structure, which sounds a bit utopian, but this is part of the aspiration reflected in those post-2015 international frameworks. This is what we're working towards, because the hazards are multiple as well. And we've heard a lot of times that climate change, as we heard from Ambili, doesn't stop when COVID strikes. This is just one feature of the precarity that happens in what we now call the Anthropocene. We're facing multiple hazards of a scale that we often are not prepared to, in urban areas as well as in rural areas, particularly in formal settlements, people who are in situations of vulnerability most exposed. So there's a real strong need for a systematic multi-level preparedness and response framework, or else next year it'll be the same.
Thank you so much. Maybe a bit in line with that discussion that is going on, we also had a couple of questions relating to sort of the balancing between rights and to what extent it is considered acceptable, or whether it, to what extent it's okay to limit certain rights in the interest of public health, as has been happening during the pandemic. I would also like to open up for anyone who has reflections on that.
I'm deferring to others, but I have a quick point, which is basic international human rights law principles, which recognize the need to interfere, or the right of states to interfere with the enjoyment of a range of rights, most rights, provided that that interference is proportionate and necessary in a democratic society and represents the least possible interference for the shortest possible period of time. And it's that kind of framework that would be beneficial to include in response measures if we don't have preparedness measures in place. If you have responses to an imminent threat to public health, then there will be interferences in freedom of movement, potentially privacy, potentially assembly, expression, and so on. But they need to represent the least possible interference and within defined parameters. So that's something that we also found in the study, that kind of language, which is basic human rights principles, was not often present in the responses.
Anything to add on that point? Lynn?
I think Matthew covered it really well. But what I'd just say, there's also a danger, even when derogations and restrictions have been followed through, you know, in a sound process, there's a danger that some of these restrictions actually will be here to stay, and that they sort of become integrated into, you know, into the system, and this erosion of rights actually becomes institutionalized and established. So that's another danger. And I think this issue came up a lot in the contact tracing sort of information. So WHO issued some very good guidelines, ethical guidelines on how to, you know, what sort of things to think about when authorities are instituting things like the track and trace, the, you know, disease surveillance, and, you know, to what extent is it okay to use the criminal law to then enforce, you know, these measures. So I think there's also that danger that, you know, the landscape changes and then changes forever. So that's a very important risk, I think.
Lee, you had something as well?
Yeah, sorry. My opinion is that.
Lee, go ahead. We'll get you back to you, Dr. Matthews, just in a minute.
Yeah, I think that it's also it's similar to what Matthew was saying, and I think one of the panelists had brought this up earlier about the balancing, in terms of what can be gained from the measures, and what could be the potential negative consequences. For example, stay-at-home orders. In terms of containment, what are the negative impacts, and how long would you impose that for? Because what does that mean in terms of the right to work and livelihoods for families who can't work remotely? The closure of schools in Kenya, they were closed for 9.5 months. What's the lasting impact for education for children? I think that those are some of those balancing acts of safety and public health versus what's going to be a very lasting impact on society for decades to come.
Yeah, Dr. Matthews had a point on that.
So if there is right information to the community, what is happening like that. So in Kerala, the Chief Minister daily briefs through media to everybody. That has been continued for about 150 days. So the community is aware of what is happening in Kerala like that. Then the second thing is the community should participate in the actions. In every activity, for example, in community kitchen, in health activity, the community is participating in a large. So if these two things are there, then the action, this human rights will be reflected in all the actions. So if there is no community participation, information is lacking, then many of the action will be against human rights. That can happen. But if these two things are taken care, then the actions will be more likely to take care of the human rights.
Emily?
Yeah, I totally agree with Dr. Matthews, and I just want to add that State of Kerala has innovated around measures which affected the human rights, like right to privacy or right to work or right to education. So the students in Kerala are not going to school still. It's a digital education. Yet the state evolved and ensured that there is some way wherein the children could communicate with each other, share their worries and anxieties. A state had a mental health counseling helpline, which ensured that those who are in quarantine can talk to people, and allay their fears and anxieties. So if you have a restriction or a policy which affects your human rights, probably I'm sure there is a way around to make it, less intolerable. So, and I think a state can do if they understand, what other people's needs, and as Dr. Matthews said, people should equally participate, so that they can together move and make it a seamless process.
Thank you. We also had some questions touching on the issue of the lack of resources already pre-pandemic, and how, having to deal with the crisis when you're already struggling with the lack of resources to put in place universal measures. And I wanted to ask maybe to Dr. Matthews and Ambali specifically, but also perhaps to the other panelists, if you have any thoughts on sort of the examples of the kind of best practices that you've seen that have a good cost benefit calculation that could be usable, and besides the ones that were already mentioned before.
And maybe you can also use this as your last chance with a few comments, because I think we're heading towards the end.
Okay, should I go ahead?
Go ahead.
So I think there were a lot of opportunities that the state of Kerala saw despite the lockdown measures. So for instance, as I mentioned in my presentation to Abid, the percentage of Keralites live outside Kerala or outside India. So they had no option but to come back to the state when the lockdown was announced. So states considered this as an opportunity and started promoting agriculture, farming, and there were a lot of startups which evolved to promote farming in traditional sectors, including providing green jobs. So yes, there were a lot of losses of jobs. There were suddenly there were people who had no income to keep their family moving, but also state gave an opportunity for people who lost their jobs to revive and see things like agriculture, because Kerala is a state which is dependent on other states for rice and vegetables. So it's an opportunity to become food dependent and food secure, and probably maybe by next pandemic at least. One thing we'll be assured is that we have food for everyone, and we may not have to depend on other states to get our basic groceries. So I think that's a fantastic approach that the state took, and not just it provides food, but I think this is an opportunity for livelihood enhancement too. So yeah. I'm sure Dr. Matthews may have a lot of other insights.
Only one thing I asked related to health. In Kerala, there was a problem of over medication. For everything, people will go to the doctor, hospital, and when the people comes, the doctor will prescribe medicines. So Kerala was going for over medication. But during this COVID period, we could see that the number of patients attending the hospital drastically decreased. And many were going for phone consultation like that. Now people knows that for everything medicine is not the answer. So this medicine has become somewhat broad, not only with the medicines, but psychological, social, and other support is equally important to medicine. So that concept has come into the community because we could clearly see that earlier everything people will go for medicines. And now the people knows that even without these hospitals, doctors, and nurses for everything, then many issues are solved. Many minor ailments like issues can be solved, and we can focus on the things which needs treatment, which needs active intervention like that. That change is coming. So through the teleconsultation, telemedicine method, we are now going to improve that thing. So the psychological support, social support, etc., can be given. Then only the people who need reference to specialists goes like that. So that's a change that is happening because of COVID in our state.
Thank you, Dr. Matthews. Morten, did you want to jump in before we run out of time?
Yeah, Todd?
No, I just wanted to thank everyone. I think specifically the researchers involved, the fellows, and the different governments, National Human Rights Institutes, NGOs, and of course the participants today. And I think often with human rights, we're really comfortable with legal frameworks, recommendations. And I think one of the questions, or a few of the questions that came in, relates to, well, how do you actually bring human rights so it's relevant for the well-being of people? And I think that this project represents an opportunity to bring people together and to take the SDG 17 on partnership seriously, because we needed a creative approach, bringing in the idea that not anyone has all the answers, and bringing in creative approaches in terms of, from the area of disaster risk reduction, from IT in terms of how do we do monitoring in the context of lockdown, so crowdsourcing. And so I think that this process of borrowing from others and bringing people together was so important to get a better sense of what was happening on the ground. And I think that my biggest regret about this project is that in the end, we only involved 14 countries in the state of Kerala, because to a large degree, the interaction that was created allowed us to begin to have a more profound understanding of the gaps and how, if we did a more systematic look at this, we could actually promote human rights in a more concrete way in the context of this very complex crisis. So I want to thank everybody and for their participation again, and look forward to a continued collaboration.
Thank you very much, Todd. And I think I can echo all what you have said, and in particular all the thanks to the participants and those who have carried out a big work in pulling all this together. And then just one issue, and that is that of course, some may have thought of why are they only looking at countries in the global south, developing countries. And I can assure you, it's true for this study, but we are definitely also looking to European countries, to Nordic countries, and a lot of the findings from the global south, we also see in the global north. I can assure you, the inequality, the inaccessibility to the right to health, and all those elements. So there is a global learning process in this, despite the fact that, as Todd rightly said, this is only limited to 14 countries and the state of Kerala. So once again, thanks a lot. Thanks to all the participants. I must say, on a personal note, I've enjoyed tremendously the exchange here and look forward to continue the collaboration. And I would also mention that, of course, you have the possibility to give input to the report. We will finalize it in 2 weeks' time. So if you have comments, ideas to improvements, then please don't hesitate to send them to Matthew Scott at the Raoul Wallenberg Institute. You can find his email address on our website. So, and the report is in the links in the chat. So have a nice day and remaining part of the week.